If you see this on NCLEX, your patient is not stable and it is a red flag. Neuroaddition, let's go. Number 1, sudden confusion. If your patient suddenly doesn't know where they're at, don't just chart it and move on. That is a change in their mental status, and that is a very good indicator that something could be wrong. Red flag number 2, unequal pupils. This one can be easy to miss if you're not doing like your full head to toe assessment with your pin light there, but unequal pupils can equal pressure. Think stroke or trauma or brain herniation. It is not just an eye problem. Number 3, decreased level of consciousness. Let's say your patient is harder to wake up today than they were yesterday. Maybe they're not just sleepy. That could be a potential deterioration in your patient. So don't wait for that to get worse. 4th red flag, slurred speech. If they suddenly start slurring their words, don't ask if they're just tired. Always assess and just assume it's a stroke until proven otherwise. You don't know until you know, so make sure you're protecting your license. Number 5, unilateral or one-sided weakness or numbness. If your patient can't move or feel one side of their body, that's not just data points for your assessment. That's an emergency, all right? Let's say that your patient has one of these neuro red flags. What are you gonna do? NCLEX doesn't want you to just notice red flags. It wants to know, what are you gonna do to act on it? What are you gonna do to help your patient? So you're the nurse. What are you gonna do now? First, always reassess. Recheck your vitals, do a full neuro check, and determine level of consciousness with your patient, because you want to know those data points and that information before you're gonna escalate. 2, always think about safety. Is your patient safe to leave alone? Can they swallow? Are they a fall risk? Make sure you're always thinking about airway, orientation, level of mobility. These pieces are gonna tell you whether or not you need to stay in the room with the patient or if you need to just call for backup like right now. After that, you're gonna escalate, notify the provider. This is not a wait and see type of situation. If it's new or worsening or you can't explain why it's happening, you better call. And you also better bring all of your assessment data with you. Next, you wanna make sure that you're anticipating what the physician's gonna order. Likely they're gonna be ordering at least a CT, probably getting some labs, maybe a neuro consult. You wanna try to anticipate and look ahead at what's gonna be happening so that you're not like scrambling and freaking out in the moment. Your last thing, document. Always document, but only after you do something. NCLEX loves to trap students with this, to document the change. Sure, you're gonna document it, but not at the risk of the safety of your patient. You can chart after this stroke risk is dealt with, because charting doesn't come before safety, ever.